I have a group on Facebook, and I don't have this on any of my slides because I just started it. So if you are a Facebook user, write this down. It's called TN Lifesavers. And if you go in the search grid at Facebook, type in TN Lifesavers, you'll probably find it. Affordable healthcare needs you. TN Lifesavers, semicolon, affordable healthcare needs you. Facebook should pull it up for you. It should find that you're like mutual friends with 40 of my friends, and then it should find us. And it's got an algorithm. So, but that Facebook group is about doing social media shares and getting more people to do the same thing. Because again, we have to take it on ourselves to spread the message on this. So every day, I find something from healthcare.gov has a fantastic Facebook page. They are always putting the coolest graphics and charts and interesting, you know how just a little meme, it's just like a little, looks like a postcard. It's got just a few words on it and a picture. People love to share that stuff. Links to videos, links to blog posts, really good snippets of information. So healthcare.gov on Facebook. You can just share, hit the share button. Don't just like it, but hit the share button so it goes onto your profile. And that's how Facebook works to share information.
Can you give us that Facebook page? Because I just looked it up and I couldn't find it.
The page, yes.
Do it in here.
Well, probably if you have 3G or 4G on your phone, you probably can. I just can't show it to you on the screen. The group that I set up is Tennessee TN Lifesavers. Just TN Lifesavers. And then the whole name is Tennessee Lifesavers, semicolon, affordable health care needs you. I don't know why I got all carried away like that. But the other place you need to go on Facebook is healthcare.gov. The name of their page is healthcare.gov. It's the same as the name of their website. So those two things right there, if you're a Facebooker, share every day. Join the group. Invite. I do have the group as a closed group. It means you can join it and other people can see it, but it's just like we won't get a lot of random trolls just commenting and driving us crazy that way. So because we really want to use it as a connective tool for us to encourage each other and learn how to encourage other people, and it's specifically for Facebookers. So a lot of the stuff you can also email out. You can do that kind of thing too, but. It's really important, even if you have your own insurance and the people you know have their own insurance, that everybody shares this information, because you don't know at what point you're going to find somebody whose kid needs insurance, whose adult child needs to get off their plan because they're about to turn 27, et cetera, et cetera. So keep sharing the information and keep driving those messages home. All right, let's start this. This presentation is not as many slides. It is not as dense in information. The focus on it is what we can do to make a difference in our communities to tell people about health care. And we're going to stop and start a little bit more, I think. So, so we won the campaign for health care. We, the Democrats, won a campaign for health care. We did that. How many of you remember what it was like back then? What was that, 2009, We had just inaugurated the president. Everybody was happy and everything was going, and then all of a sudden the Tea Party started up, and they started hammering down, and people started to complain. Why is he doing this now? Why is the president doing this now? Why did you pick the hardest thing to do, and you're not doing it right and all this? Well, I think when you turn around and you look back at that time then, and you look at how far we've come now and how low, especially in Tennessee, we've gone, you can kind of see why we did this first. Because what? It's a life and death issue. And I was really mad. I was like, I need the information to really talk to people. What is this really going to do for them? How is this really going to work? What can I do to make people pay attention to what counts? And why is it going to take till 2014? Well, now that I'm working on it from this end and I can see how complicated it is and what's happened, we implemented this as fast as we could. And we're still working hard, and we're still pushing to get traction. And in a place like Tennessee, we're still fighting so many misconceptions and misinformation. And for Democrats, I work with a lot of nonpartisan organizations. I work with a lot of groups that have a very hands-off, arm's length on political partisanship. And that is as it should be. But just know that as a Democrat, you have a really important role to play, because I got my bumper sticker in the mailbox. That's my mailbox. I went out there and I ripped that thing open, laid it back down, and took a picture, and put it on Facebook, right? So, oops. Sorry. There.
Where can you get one of those?
Well, I got it online. I got an email about it, and it said it would send me one. So I bet you can go to OFA or DNC. It probably came from the DNC. So that's my bumper sticker. So we're the only ones who know about it, because my neighbor next door did not get a bumper sticker because they don't get emails from the DNC, right? So, but those 400,000 Tennesseans who are going to qualify for the affordable health care marketplace in Tennessee that we already talked about, they don't know that we won the health care campaign. And very few of the people who do know that the marketplace is going to open. And very few of the people who know that the marketplace is open know that it could help them. Know how many people, 400% of poverty, that's a healthy income for a lot of folks. They could benefit, and even people over that poverty level will benefit. Yeah, I had it made, and the guy who made it for me sort of adjusted the file so it fit good on that Coro sign. You could, and I spent about $20 on that sign, without a stake. You could send this file to Staples, and I think it's like $7.99 a square foot. So you could have it made as big as you want to. You could probably spend $10 or $15 or $20 on it to make a nice poster, put it in one of those frames, take it out, however you want to do it. It's just a really nice poster to get attention. You could design your own poster if you want to. How the marketplace works. This is on the back of that 8.5 by 11 that I gave you. I think this would make a great poster, or at least a table topper, or a banner, whatever you want to make out of it. I just think it really, here's what I think is valuable about something like this. It guides you through the process of talking to someone else. Okay, so you're not just all over the place with their random questions. It gives you a guide to help them, and it kind of solidifies that healthcare.gov.
Yeah. Clarify that, please.
Yes, ma'am.
To create an account, that's where they get their password. So
That I've ordered some of, and you could order them unless they've gotten sold out now. Or I've got this as a PDF, and it's got a front and back. I think I only have the front on the slide. But it's about just the general information. You can print that out in black and white. It doesn't look too bad. This is the flyer that I already handed you. It's got the phone number on it. It's got some good info. And I've got the sign-up sheets that we talked about. So you can print out a sign-up sheet, or you can make a fancier sign-up sheet. Yeah, I do mine pretty simple. Volunteers. Don't forget to get volunteers and then follow up with them. And so that's your outreach kit. And so that's step one. That was in step one. Step two is getting out in the community and actually getting it started. So get your enrollment kit, your outreach kit rather, not enrollment. Get your outreach kit. Print your outreach planning 101 out. Print out one copy of each of your thing, and then get together at a coffee shop with the other people you want to work with. And plan out your plan of what you're going to do. These are just some ideas. Having info tables. I think we all love info tables. Don't we love putting up a booth and putting a table out and standing there and just talking with people as they come by? But that's not the only thing. You could have face-to-face conversations with people all over the place, all kinds of different. If you get your group, your Lifesaver team, really going and really active, and outreach is your thing. Maybe you've got a couple people who've done the CAC training and they're ready to go with that too. But Enroll America has a campaign called Get Covered America, and as of yesterday, they are hiring in Tennessee a statewide director. Okay, so that means that there's a big data set that's going to become available, and if you're working and your Lifesaver team is reaching out to people, and you want to take it a step further, you want to go on a door knock, you want to do a phone bank, you really want to make sure that instead of reaching 50 or 100 people, you're reaching thousands and thousands, and maybe some of the 10,000 people in your county or so who could enroll in this plan, then you can get connected with what Enroll America and Get Covered America are going to do. You can get even more data. You can get going at that kind of field level and then do the data entry. It's a lot like Vote Builder, so it's pretty easy. Now, here's the win-win part, Congress. Or they might decide that they can run for county commission or school board, or that their brother-in-law should, and they're going to manage their campaign. So I'm not trying to exploit the fact that we're going to save people's lives. I'm just trying to say outreach is where it's at for Democrats, okay? Being a CAC is fantastic, but outreach is where it's at for our organization. So check-ins. What are check-ins? I'm trying to use different language for things. face-to-face is door knocks, keeping the details is data entry, and check-ins are follow-up phone banks. So I'm trying to say these things in ways that don't like put us to sleep, and because we've all tried all that so many times and we get so weary of it. But with the healthcare, with this being a life and death issue, I think it re-energizes us and it makes us see how important this is. Oh, it's almost done because we did win. We won this, and now we're going to go out there and make it count. I've been putting online, we won it, now let's own it. I think that's a fun way to do it. But the campaign for healthcare is about a whole lot more than just politics. It's about showing people how to care. We talked about everybody cares about people, but they're getting a lot of really bad models out there in the world. They're getting a lot of really bad examples. And you know how you have to set an example for people to follow. I mean, I think that's the whole point of the verses in the Bible about this, about taking care of the least of these. And helping others and turning the cheek and doing what's right. So you have to set a model for that behavior, and this campaign does that on a really deep level. How to be there for each other and how to stand up for themselves and their country. And this is about our whole country being stronger. I'm a very loyal person to Tennessee. I've lived here longer than anywhere else in my whole adult life, like 23 years, 26 years. I'm not 26, that's my adult life, folks. Sorry, I was like, no, I've lived in Tennessee that long since after college. So it's about the loyalty that we show to our state, to Tennessee, and to our whole country, because Tennessee needs to lead again. We don't feel like leaders right now, but we need to lead again. We're going to figure things out that nobody else has figured out. We're going to do it through hard work and experience, and I think this healthcare campaign is going to bring us to that point. That's just me. So some resources, healthcare.gov, you all know all about that, right? Marketplace.cms.gov, and we looked at that, and that's just the training part of it. You can get the resources from it. You can become a champion there. Consumer Reports, have you seen the issue of Consumer Reports? Aren't you excited about that? Who has seen it? Only a couple of us? Okay, so you got to go buy Consumer Reports. You got to leave here and go buy the newest Consumer Reports. Or get it online. There's the thing. I'm going to add that to the thing that everybody needs to have that in their outreach kit. And you know how you get your subscription in the mail quicker? So maybe the newest, make sure that it's in the one that's on the newsstand right now. It's page after page after page of information. Jim will love it. Everyone will love it. Of all these details and great information about the plans. And, I mean, it's nationwide, obviously, but it's got Tennessee information in there, and it's so credible. People love Consumer Reports, right? What's more credible than that? Other than the Heritage Foundation. So, and then I never went to the KFF.org, Kaiser Family Foundation. I personally find the website a little bit thick. A little hard to get into. The calculator is really good, but we're going to be able to calculate the real stuff in 2 days. So, And in Tennessee, enrollamerica.org, getcoveredamerica.org. And the volunteer lead for that organization has been Jackie Schrago. She's still a great contact. I didn't put her phone number on here just because I hadn't got a hold of her to get her permission. But if you're interested in more field work, you can sign up for their emails. And we're going to be knowing more about Tennessee soon. And we'll get that information to you, too, through the county parties. So we want to coordinate that. Not coordinate it specifically with that organization, because it's a nonprofit organization. They can't coordinate with us. We just want to help you to get the resources that you need as you need it. And then seedco.org, we talked about that a little bit. Right now, that website doesn't have a lot of really practical information for us. It's telling us right now to get together with our local folks, find our local stakeholders and community activists and that kind of thing. I think that eventually I hope that there'll be more of a clearinghouse for where local resources are. And then THCC too.